Welcome back. Time's now 7:14, and every 10 seconds, someone in the U.S. goes to the emergency room due to head pain, and 1.2 million visits are for acute migraine attacks. That's according to the Migraine Research Foundation. It is National Migraine and Headache Awareness Month, and Dr. Brent Wallis joins us this morning. First and foremost, to kind of help people figure out the difference between a severe headache and, say, a migraine. What is the difference, Dr. Wallis?
Sure. So migraines are just one type of headache. There's several different types, but migraines tend to be either moderate or severe, and they can actually be accompanied by other symptoms, so not just the head pain itself. So migraine sufferers kind of classically also have trouble with their vision. They may see lights. They have a lot of sensitivity to light itself and sound, and then sometimes can actually develop nausea and even vomiting from the head pain itself.
And are there specific groups that are more prone to suffer from migraines?
Yeah, there definitely are. So women are about 3 times more likely to have migraines than men, and migraines definitely run in families. So if you've got a family member that has a history of migraines, then your headaches are probably a little more likely to be migraines as well. And then people who have really bad sinus allergies can have a lot of difficulties with migraines because environmental exposure to certain things can actually cause regular headaches as well as migraine headaches too.
And Dr. Wallis, I know there are lots of over-the-counter options as far as migraine treatment is concerned. I guess let's talk about those. And then at what point should people maybe put those aside and seek professional help from a doctor to perhaps get a prescription?
Sure. Yeah. We do have a lot of great over-the-counter medications that people can self-medicate, but you have to be a little bit careful. A lot of the medicines that we take regularly, so things like acetaminophen, which is Tylenol, or ibuprofen, which is Advil or Motrin, those can be very helpful with migraine headaches. The problem is if you take too much of those medications, they can have side effects. They can actually cause something called rebound headaches. So you can actually make your headaches a little bit worse, and then they can have effects on your stomach as well. So what you really want to watch for is if you're having migraines more than a couple of times a month, and definitely more than a couple of times a week, then you want to talk to your doctor about some non-over-the-counter or prescription type treatments that can be done, and maybe even preventative treatments to keep you from getting migraines.
But definitely something you should be having serious conversations between you and your doctor about, and as you mentioned, not trying to over self-medicate because it could lead to other issues. Dr. Wallis, we appreciate your time this morning during this National Migraine and Headache Awareness Month. Have a great weekend.
Thank you. You too.